What in The Handmaid's Tale is Elon Musk talking about? Yesterday, he randomly decided to put this statement out into the world with absolutely no context, saying hormonal birth control makes you fat, doubles the risk of depression, and triples the risk of suicide. This is clear scientific consensus, but very few people seem to know it. Now, unfortunately, this is not the first time that we've heard from Elon on the issue of birth control. He actually soft launched his anti-contraception campaign last year in this interview with Tucker Carlson, where they both were discussing their belief that contraception and abortion are two things that are going to lead to the downfall of civilization by depopulating the earth. A problem he seems to be trying to single-handedly remedy. I mean, he's on what, kid number 11? Not judging, just an observation. His goal to keep the earth populated is well and good, but conveniently enough for Elon, he doesn't have a uterus. So he doesn't have to think too hard about the impact that one pregnancy after another would have on his life, on his career plans, on his general health and well-being. As my colleague Dr. Crawford astutely pointed out, all of the associated harms that he listed when he was bashing birth control are things that you're actually at a much higher risk of when you're pregnant. This becomes very clear and obvious when you look at data comparing the rates of maternal mortality among all groups in states where there are abortion bans, as seen in red, compared to states with abortion access. His statement said there's a scientific consensus, but all he really did was share one cherry-picked study that was a retrospective analysis of registry data, looking at outcomes like suicide, mental health, and exposure to birth control, and drawing an association. And these types of retrospective studies are extremely biased. You cannot prove causation, and you can't possibly account for all of the important other variables and factors. As for his claims about weight gain, birth control does not directly cause weight gain, but the estrogen component in hormonal contraception can lead to fluid retention. Not in all patients, but in some. And nowadays we're using much lower doses of estradiol, so this tends to be minimized. And there have been many studies across the board that have shown that formulations such as the pill, patch, ring, IUD are not associated with weight gain. There are some forms like the Depo-Provera or progestin shot or the implant that have been associated with weight gain in some, but not all individuals. Birth control, like any medication, can have certain side effects, and it's not for everyone. And certainly there are some individuals for whom it may be high risk, and there are clear indications and contraindications where it's not suitable. So my point is I don't really care if you individually want to use hormonal birth control or you don't, but it is a reliable form of contraception that can help people prevent unplanned pregnancy, and it can have a variety of health benefits. I have a lot of patients who say that the birth control pill and hormonal contraception have changed their life for the better because it's treated their endometriosis, their PCOS, it's helped them to lead a normal life. There are even long-term health benefits like prevention of major cancers, ovarian, colon, and uterine cancer. A lot of people don't know that. My point is that you have to have a balanced view, and listening to blanket statements like this from people that have a clear agenda is not going to help you. It's important to have a balanced conversation with your doctor, looking at the nuances of your health history and your goals and what you're trying to treat. So Elon, if you're watching this, please just get back to working on whatever it is that you're doing, whether it's trying to get us to Mars or baby number 12, whatever comes first. Leave public education about birth control to the experts, to the board certified OBGYNs. Thank you.